Good morning. Okay, we're going to call this the A section and the B section and the C section. Good morning, C. Good morning. Good morning, A. Good morning. Good morning, B. Good morning. B wins for this round. Anyway, all right, let me get myself organized here. So, welcome. My God, those lights are bright. Very glad to see you all here, and I know that, oh, thank you. I know that more people are going to be showing up. We've got over 300 individuals signed up today, and we've got a number of people who are joining via Zoom, which was a last-minute thing we did. There are a number of people getting COVID, and a number of people who decided wisely and correctly not to be here today, and so they're joining us remotely. Hope you all feel better. So about Delaware Health Force, we're focused on four things. We're focused on data and research, really understanding the nature of our workforce, license type by license type, board by board. We're interested in the expansion of graduate medical education, be it for physicians, for nurses, for various therapists, allied healthcare professionals, and I know that that's not a popular term, but it's what popped into my mind. Sorry. We run Delaware Mini Medical School, which is a starter program. It's the beginning of the pathway. Hopefully, students who are in 5th grade through 12th in undergrad school will choose something in the healthcare profession later down in life. And we also have taken a part of the ARPA funding, and we're doing interest-free loans for Delawareans going primarily to Delaware institutions to pursue a variety of degrees except for physician and dental training, which we already had a loan program for. So in any event, that's about the Delaware Health Force, and I want to hit on one word in the sort of that those 5 words here, and that's reframe. We're at a difficult point, as everyone knows. You're here, you understand we have shortages, we have burnout, we have an aging provider population, we have all sorts of stresses, and reframe is the word that I want to focus on. This represents opportunity. Opportunity to collaborate in new ways, opportunity to leverage technology in new ways, thoughtful dialogues with payers about how we can speed up the process of practitioners being compensated for the work they do on behalf of the patients that the payers and the providers share. There are a number of things we can do together. So we need to reframe this. We need to come together as a community more than ever. We need to double down on that collaboration. So at this point, I would like to have my voice crack. I'd like to invite Rebecca Walker to come up to the podium. Rebecca, wherever you are. She's talking with somebody. And there she comes. Quite all right. We understand the work is never done. All righty, and Rebecca Walker is with the Division of Public Health. I'll allow her to introduce herself further. Ladies and gentlemen, Rebecca Walker.
Well, I can tell you one thing, Tim wasn't wrong, that light is really bright. I feel like a rock star person. So what I'm gonna ask first, if I could, real quickly, if you are a clinician, anybody who holds a license in something, do me a favor if you would and stand. Okay, so you're almost half the room, right? That's awesome. I'm a nurse, that's very important to me too. All right, have a seat. If you are in a leadership role or oversee a team or make business decisions, stand. That's about the other half of the room, if not also clinicians, right? Okay, guys, have a seat. So what does that tell you? First off, this is a sold-out event. Kudos to you guys planning this. It was obviously a very important topic. Second of all, it's a cross collaboration between two groups. That's awesome, bringing the right people to the table to have those important and hard conversations so that we can value each other's perspective and move forward. This issue that we're going to discuss today and some of the presentations and some of the panels, they're going to be really informative. This is not just a Delaware issue. I am one of the deputy directors in public health. I oversee all the clinical science operations sections within them. The clinics, how we utilize nursing staff, how do we utilize community health workers, how we utilize our epidemiologists and other caseworkers and individuals who have that direct line impact to people's health. What can we do that expands our scope? How can we expand or make sure that our providers and our clinicians are working at the top level of their license so that other work that they might not need a license to do can be incorporated into something else? How else can we get that work done? Those are the kinds of hard decisions and the conversations that I think we need to start having, all of us, not just us in government, but us also in organizations. What are we doing to promote lifelong learning? There is a lot of really good programs in your pamphlets today. Please bring these back. Show your staff members that there are options and opportunities for them to continue to learn. What are we doing for staff wellness, retention, resiliency? I would say that there's 4 key concepts. If I keep stepping away, I apologize. I have a habit of walking around, and then I also noticed that my heel just got stuck. So you know that lady that this gets healed? That would be me. They call me Grace. There's 4 key concepts I would like all of you to consider as you're listening today. The first one is resilience. Everybody that is here has lived through that pandemic that, yes, we keep still referencing because it's still in our head and we're still, responding to it. We've gotten through it, and you're all still here. That demonstrates that everybody in this auditorium is resilient. If you work in high intense areas and you're still here, kudos to you, you're resilient. If you've led organizations and kept things going, you're resilient. We got to keep promoting that resiliency. It's not bad. Having that strength is a good thing. Being kind with that strength is a better thing. The second thing I would like to talk about real quick is retention. How do we retain people? Oh my gosh, we lose people left and right. Look at the numbers of respiratory therapists post the pandemic. Their numbers are down big time. And that's a very professional statement, down big time. They're down, but we're working through ways to figure out how we can make sure we build them back up and we get those providers back to the bedside. Promoting that culture of lifelong learning, staff wellness. Doing something very small might seem very small, but it can have a big impact. Identifying a group of people, sending out something and saying, hey, anybody want to go walk at lunchtime? Anybody in the organization or in this building that wants to go walk at lunchtime, meet at this spot under the tree or whatever at noon every day, and we'll take a half-hour walk around the campus. It helps people get out because they know they're going to be included. They know there's someone who's going to be there with them. They're not doing it alone. And people are like, where'd you go? It's and then they'll develop new relationships, right? They'll be able to talk to other people in the organization and grow. Inclusion. When I say inclusion, I like to think of inclusion as including everybody. And when I say that, I mean, and this might not be a very popular statement, however, a lot of leaders go to a lot of conferences, and it's important information that we get there. But what if we took one of those conferences and sent those funds down to the frontline stakeholders, the frontline workers that are contacting every day those clients, and show them that, hey, we value you. You're important to this organization. We want to keep you. We're going to send a group of you to a conference, and here's how we're going to do it. Or reach into one of those middle managers or somebody that's on your team and say, hey, I'm going to this conference. Come with me. I want you to see what's going on so you know that you're important in this organization. We want to keep you. We want to retain you, and you're valued. Several decades ago, if you're a native Delawarean, like many of us in the room, because I recognize a lot of you, there was an organization where everybody seemed to work there. Your brother, your mother, their sisters, their cousins, their grandmothers, everybody in generations worked at the same company in Delaware. And I'm just trying to figure out how the heck they did that. so that they had that retention, they had that resilience, people were proud of where they worked for, and we were empowering them to be able to gain and grow in that organization. And for those of you who don't know it off the top of your head, it's DuPont, right? Oh, I'm so glad I wasn't the only one. It just came right to your head. So DuPont did that. We can learn from organizations outside of healthcare. We don't have to stay in the healthcare world. Let's look at what Google's doing. How are they promoting innovation? How are they getting and energizing staff to be able to perform at a higher level, who were proud and excited to be there? What can we do to make that happen? Not just within our government, but within our private organizations, everybody. What can we learn from other business groups? And lastly, there's a place for everyone. There really is. And there is work for everyone. No one is too proud. Everybody can be included. We have community health workers. We have clinicians. We have physicians. We have other providers. We have mid-level providers. We have educators. We have people with disabilities. There are people across the board who have a value and can make an impact. Us people getting older are also we're here, we're still here, and we want to continue to do good work. Volunteers, veterans, everybody has a place. And all I say is, as you go through it, if I could challenge you to do one thing, you're listening to these panels and you're listening to these good speakers and they're providing you a lot of good information. Pick up one thing, one item, bring it back to your organization, try to implement it, if not within the big organization, within your team, and see what impact that makes. Show your team that they're valued, promote that resiliency, promote that retention, and have a great day. Thank you, guys. I appreciate you joining.
Thank you, Dr. Walker. All right, I'm going to introduce our two co-chairs now. First, Nicole Moxley. Nicole is a senior level manager who oversees the State Primary Office, State Office of Rural Health, and the Conrad State J1 visa waiver programs for Delaware. Nicole specializes and manages these programs to alleviate access to healthcare issues in Delaware. She engages and leverages partners and stakeholders to support and develop health systems to address the healthcare needs of diverse community populations. She holds a Bachelor's of Science in Business Management from Wilmington University. Nicole, come on up, please.
Well, good morning, everyone. Good to see everyone's faces here on this rainy Wednesday morning to talk about health workforce concerns, and they are very large in Delaware. As Tim said, I do oversee the Primary Care Office, the State Office of Rural Health, and the Conrad 30 Visa Waiver Program, and they are very important to our health systems because us understanding where the shortages are, where to place the clinicians in need, how to properly leverage the J1 visa program and the HHS waivers so that we can make sure that we have providers giving that very important primary care. What's happening in oral health, what's happening in dental health. We have shortages across the spectrum. So if I don't know you or I don't have your email, please let me know because I do like to push information out on all of my programs. We facilitate National Health Service Corps loan repayment, as well as Nurse Corps. We cannot forget about all the spectrums of who provide care across our state. So in the interest of time, those are my welcoming remarks. I really hope that we have a robust agenda for you today. Appreciate everyone being here, and enjoy your day. Thanks so much.
And I will say that the crack in the stage is real. Anyone who's up here with high heels, beware. So, next co-chair is Julia O'Hanlon. She leads a wide range of public policy-related projects and provides salient research, support, and technical assistance to the University of Delaware Biden School of Public Policy and Administration's IPA staff, state and local government officials, and nonprofit associations. Julia's primary expertise involves state and local management, aging-related policy issues, big topic, intergovernmental Intergovernmental Relations and Public Personnel Management. Her recent public policy research activities have focused on program evaluation and funding of senior centers, researching healthy and walkable communities, and researching issues related to youth aging out of foster care in Delaware. She also serves as IPA staff liaison to the Delaware League of Local Governments, aiding in ongoing communication among staff, local officials, their staff, and IPA project leaders. She holds a master's in public administration from the University of Delaware's Biden School. Julia?
Good morning. I'll just echo what's already been said. It's a pleasure to see so many amazing people in the room today. And I've already seen a number of people who I recognize, but there's a number of folks who I hope to either get introduced to or connected with at some point. So thank you for being here. As Tim said, I'm with the Biden School of Public Policy and Administration's Institute for Public Administration. That's IPA for short. We've been around for over 50 years in the state of Delaware, working with a variety of state agencies and local governments. And our work really cuts across a lot of different areas. So today's work, as the staff liaison and with the League of Local Governments, and I also run our health and aging services, policy services at IPA. So this really cuts across a lot of our work, whether it's education policy, obviously access to care, including social determinants of health, transportation, housing, et cetera. And then also with our aging population and the demographic trends that we're seeing in this state. So I'm very happy to be here. I look forward to these amazing conversations, and that's it. Thank you.
Now I see what's happening when you walk up the stairs, the whole stage shifts. We'll do something about that on a break. So I wanted to point out in the program, the Planning Committee members, and I wanted to do a special thank you to Dr. Nancy FAAN, Secretary of Finance for the state, Rick Geisenberger, Ann Painter, our own board liaison for the Academy DPHA, and Dr. Kate Smith, our executive director. And we've actually had a third co-chair in this who's been a partner on the side, so to speak, and that's Kathy Matt. Kathy, you have been absolutely fantastic in supporting us, greatly appreciated. And everyone, Dr. Kathy Matt. And at this time, I'll ask Nicole Moxley to introduce our first speaker.
Well, good morning again. It is my privilege to introduce Michelle